My name is Megan Grant, and this is my informative speech on diabetes. Diabetes is a polygenic disease characterized by abnormally high glucose levels in the blood. From a recent survey, 25.8 million children and adults were diagnosed with diabetes. There are 7 million people that are undiagnosed and 79 million people that are predisposed to diabetes. From the numbers alone, you can see that diabetes is becoming a major problem in our nation. Through learning the dangers of diabetes, understanding how you can get it, and learning ways to prevent the disease, America can keep diabetes under control. In discussing the dangers of diabetes, I will first go over the 3 types of diabetes, as well as some of the more dangerous side effects: neuropathy, nephropathy, and retinopathy. Type 1 diabetes is known as juvenile diabetes because it is unusual to acquire type 1 past your mid-20s. Type 1 diabetes lasts for life and extensive insulin therapy is required. Type 2 diabetes is known as adult onset diabetes. An unhealthy lifestyle, or for women, getting gestational diabetes while pregnant will lead to type 2 diabetes. There are some slight differences between type 1 and type 2 diabetes. For example, if one identical twin develops type 1 diabetes, then the other twin has a 50% chance of developing it as well. On the other hand, if one identical twin develops type 2 diabetes, then the other twin has a 95% chance of developing diabetes. Gestational diabetes is acquired during pregnancy and is caused by hormonal changes and imbalance. Gestational diabetes usually goes away after childbirth. Neuropathy can affect the nerves throughout the body, but most commonly affects the hands and feet. In type 1 diabetes, neuropathy may not develop for many years. However, in type 2, it can occur much sooner. Nephropathy is a condition in which the kidneys no longer function properly. It is a common side effect of diabetes, and almost half of all diabetics will develop some type of damage to their kidney cells. Retinopathy is a complication of both type 1 and type 2 diabetes. When blood levels remain too high for a long period of time, changes can occur in the tiny blood vessels of the retina in the eye. A person may notice strange blotches, blurriness, or dark spots in their vision. If retinopathy is not treated, it can lead to blindness. Some of the less dangerous side effects and symptoms include frequent trips to the bathroom, unquenchable thirst, weight loss without trying, and fatigue. Next, I will go over how you can get diabetes. Unlike what some people may think, diabetes cannot be caught like the cold. People can inherit a tendency for the disease, but cannot inherit the disease itself. There are several factors that give a person a higher risk of developing diabetes, such as heredity factors, immune factors, and triggering factors such as stress and viruses. Some infections have been shown to trigger type 1 diabetes, such as the German measles in infants. Type 2 diabetes has a strong hereditary factor in developing diabetes. Certain ethnic groups such as Hispanics, African Americans, and Native Americans have a stronger tendency to develop type 2 diabetes. Gestational diabetes can only develop in women while they are pregnant. If a woman has a high blood sugar level while pregnant, she will develop gestational diabetes, but after the baby is born, her body will go back to normal. However, 25 to 50% of women who have gestational diabetes will develop type 2 diabetes later in life. Last, ways of preventing diabetes are easy to understand and very simple to follow. Changing your diet is the first step to changing your life. Small changes such as eating more vegetables, eating less fast food, and drinking water instead of soft drinks will quickly change your health. By doing moderate exercise, such as walking your dog or playing your favorite sport for 30 minutes each day, coupled with 5 to 10% weight loss, you can reduce your chance of diabetes by 58%. Those numbers are hard to argue with and easy to obtain. Only if absolutely necessary, take doctor-prescribed medication to bring your numbers down as well. The American Diabetes Association is developing materials that will help people understand their risks for diabetes and what they can do to turn back the clock. Through learning these things, we can prevent diabetes from becoming a bigger threat to America. In conclusion, I want to point out that everyone can change their future if they work hard in the present. My mother recently found out she had type 2 diabetes, mainly caused from gestational diabetes. She began with a blood glucose level of 250 and higher. Through dedication, hard work, and the support of family, she's gotten her blood glucose level down to almost normal and is living a healthier, happier, more fulfilling life. This disease does not have to control your life. You can control the disease one day at a time. Thank you.